And welcome back. Well, we've gotten quite a bit of information about this medical cannabis from our guest today, Michael McAuliffe. He's got even more to tell us about the current prison situation for profit that stands in the way of a lot of good sense. So, Michael, just give us a little bit of background on what's going on with this prison for profit.
Well, it's interesting. Out here in Pahrump, I know in the past several years there has been a large community fight about the new prison that's opened from
Yes.
Correction Corporations of America. And I've kept an ear to it because I have a friend and attorney out here, Nancy Lord, who was leading the fight against this prison opening just in such close proximity to people's homes. And the problem that we have is that here in Nevada, it costs $26,000 per year to keep an inmate in the state penal system. And while we want those dangerous, violent people in jail,
Right.
what we're doing by outsourcing this to a private for-profit industry is encouraging other people who are nonviolent offenders to be sentenced to jail time. CCA has recently proposed to 20 different state legislatures that they will take over their state prison operations if those legislatures will guarantee them a 90% occupancy rate for 20 years. So what we're doing is taking the people's obligation to incarcerate and rehabilitate prisoners and turning that over to a private for-profit industry that benefits by warehousing people and only encourages more and more people to be brought into the prison system. Already, we in America represent 5% of the world's population, and yet we have 25% of the world's incarcerated population.
Wow.
Does that really mean we're 5 times more evil than the rest of the world? Or does it just mean that we have big lobbying groups who are making money from getting people locked up and keeping them in a system that is obviously broken? We have 30% of national monies spent on police, spent on anti-marijuana efforts. And this is a subject, and getting away from medical marijuana, the Gallup organization, which has been conducting polls on this issue for 40 years now, for the first time in just the last couple of months, a majority of Americans, 50%, are in favor of legalization of marijuana versus 46% opposed. First time this has happened. And now we have so many people who are saying that we just cannot afford to keep locking people up and ruining their lives over this issue, and yet the lobbyists, the people in political power, the law enforcement unions are all still fighting to keep this very illegal in order to ensure their profits. And I'm not here advocating recreational use of marijuana. I'm just stating facts that are out there. And the American people, and not only the American people, you see coming now from Central America, from South America, the heads of state there are all crying for market alternatives. That's regulation. That's setting up a system by which people can buy this, because they are dealing with so many thousands of their own people getting killed as a result of America's insatiable appetite for drugs.
Wow. I just can't get over that stat, though, of these for-profit prisons dictating to all of these different municipalities that, hey, we can take this problem off your hands. It'll cost you so much, but you have to fill it up to 90% capacity. This isn't a hotel. These are jails.
It's astounding.
And they dictate that, and these municipalities say, well, we can fill them up. We're glad to have you take it off our hands.
Fortunately, public pressures in a number of these states are getting the state legislators to turn them down. But this is an ongoing situation. And right here in Pahrump, we have one of these prisons open, and the state is saying, well, yes, we're able to save money because we closed the Nevada State Penitentiary, which was opened in 1865 and was obviously beyond its useful life. But independent studies have shown that the cost to the state of private prison incarceration is actually more than if the state were to run it. And so the idea that outsourcing is going to save the state money is just incorrect.
Wow. Okay. We've covered quite a bit of the boondoggle on this side of the issue. Let's just briefly touch on, if someone would like to get the remedy of medical cannabis, what are the steps that they can take?
Well, the first thing that people have to do is get a hold of the Nevada Division of Health up in Carson City. Probably the easiest way is they can just Google or Yahoo medical marijuana program, Nevada, and the very first hit will take them to the webpage of the State Division of Health. They'll need to send up a $50 application check along with their name and address, and the state will then send them a kit which has all the paperwork they need to get. Then at that point, they would need to get to a physician who will sign a recommendation for them. They need to get fingerprints taken. They need to get a couple of documents notarized, and then they send all this paperwork back to the state with an annual fee of $150, and the state will then send them back their permission and a letter, and then ultimately they'll get a card at the DMV which will allow them to be authorized patients on the program. One problem that people have had is finding physicians who will sign them onto it. And if people have this need but their own physicians will not, for whatever reason, be willing to sign them on, then there are any number of doctors I know in Las Vegas who will do so, and their patients are more than welcome to get a hold of safeaccessnow.org or call us at our law offices, and we'll be happy to forward them on to someone.
Okay, great. And I'm putting up the phone number there of the law offices of Michael Prenti, where you are working. So just one last item here. Judge Mosley made his ruling a couple of weeks ago. Are the wheels in motion? Is anything happening? Who's got the ball now, and what's going to happen?
Who's got the ball? That's a good question. It's been punted into the state Supreme Court, and so you have the legislators who haven't wanted to touch this issue, and this law has been broken, and people have been getting felony and misdemeanor convictions for the past 11 years based on implementation of this flawed law. And so now the state Supreme Court is going to have to decide whether or not this is constitutional. Whichever way they decide, the bill that Ed Goodhart introduced last year is going to be reintroduced in the next session in 2013. And I would ask everyone out there to get a hold of your legislators, both your state senators and assemblymen, and tell them that you support this reform. It's logical, it saves taxpayer money, and it is compassionate for people who really need the help. And if there are people who will say, well, you know, this is a system which is going to be abused. Any system ever devised by man has found other people who are willing to find a way to take advantage of that system. And just because that is a common human trait does not mean that we shouldn't be compassionate and understanding to people who are in pain and suffering, and allow them any means to have a better quality of life.
Don't throw the baby out with the bathwater.
Absolutely.
Just out of curiosity, of the 16 states that do have this remedy for people, is there one or two or several that are shining examples of how to go about doing this?
Absolutely.
That work very well?
Absolutely. Colorado has the most fully developed regulatory system in the nation at this point. The Colorado and Nevada program started within a year of each other, and for a goodly number of years at the start, they both had just several thousand patients in them. But Colorado, by embracing this constitutional reform and setting up a framework for dispensaries, for growers, for taxation and regulation, now has well over 100,000 people, and the state of Colorado is taking in the first year that they did this, in 2010, they took in $16 million in state revenues, plus generating hundreds of millions of dollars in the industry in general, which was respent in the state community, because none of the medical cannabis produced can cross state lines. So Nevada's industry, should our legislatures have the courage to undertake this reform, that money will stay here in the state of Nevada. And you have California and Washington and Oregon, who are all moving forward on this issue. Detroit, or I should say Michigan, is moving forward on this issue. New Hampshire, even New Jersey are setting up dispensaries. So it is well beyond time for Nevada to be the libertarian-leaning state that it is and to move forward for this kind of reform.
Yeah, and show me one state right now that couldn't use the extra revenue, especially Nevada. Well, hey, thank you very much for coming in today, Michael. Very enlightening.
Pleasure.
And I hope people do contact their legislators and get this thing turned around. Let's get some common sense going, folks. That's it for today's episode. Tell your friends to watch, and we'll be back with another episode of Talk TV. Keep it right there on TV Guide. Have a great day.